Good afternoon and welcome everyone to this special event of Citizen Tales Commons Collective called Citizen Tales Commons gnoriZO, Anti-COVID initiative. We're really excited to host this event. It is in the frame of all the series we host seminars, workshops, exhibitions for the sake of common good. We are a collective of more than 60 scholars, international scholars, who are fascinated by the concept of citizenship and civic engagement and work together collaboratively for equitable futures. So today we have two esteemed members of our collective, Antonis Psarakis and Dionysis Rigopoulos, who are going to present their own initiative, gnoriZO. gnoriZO, which means in Greek, to know, and it encapsulates the word to live, zo. Antonis Psarakis is a concept developer and has created this concept. And also Dionysis Rigopoulos is an engineer specializing in computational modeling. You can find out more about their work in our website, our team website, the page of our website. And I also wanted to let you know that we're going to record this video, this session, and we're going to upload it in our channel, the YouTube channel of Citizen Tales Commons. So if you don't want to be in the video, you're welcome to turn off your camera. You're also welcome to use the chat feature for posting your comments or your questions for further discussion. So after the presentation, there's going to be this Q&A session, and hopefully we're gonna have a wonderful conversation on this very, very important matter in our fight against coronavirus. So the floor is yours, Dionysi and Adoni, and thank you again for coming together with us.
Thank you very much, Vassiliki. Antonis is now going to share the screen. And the COVID-19 pandemic is an unexpected worldwide situation with almost everyone involved. People come to realize how important it is to share reliable knowledge. Trustworthy data are a sine qua non for decision making. And nowadays, more than ever, trust can be established and broken much faster than in normal times. So when some weeks ago, Antonis came with the seed idea of the gnoriZO initiative and invited me to join forces in developing the concept, I was very happy with the challenge. There is often a consensus on what, but the how remains fuzzy. This stops things that we all agree on from happening, and the gnoriZO initiative focuses exactly on the how. The title, as Vassiliki said, is inspired by the Greek verb gnoriZO, which means I know, but emphasizing the last two letters of the word, zo, which means in Greek I live, puts the idea that understandable scientific knowledge can be the life-saving game changer. Sincerity and cooperation among people determine a better future. We are all on the same boat. gnoriZO is the key to an honest and comprehensible, yet scientific briefing for the pandemic. The core elements of the approach are a unified documented content, putting the message gnoriZO at the center, multi-channel distribution with digital booklet, with web pages, with presentation to mass media, and active engagement of everyone with whatever they can contribute to the common cause. Antonis and I feel grateful to Vassiliki and the other Citizen Tales Commons members for offering the opportunity of this presentation and the discussion that will follow. Antonis will now very concisely present the overview of gnoriZO so that we have more time for Q&A and for your ideas about the initiative, its next steps, potential improvements, etc. After all, we are all firm believers in collaborative and collective intelligence. Antoni, the floor is yours.
Good evening, ladies and gentlemen. From Athens, Greece, I would like to welcome you once more And I would like to proceed to the concept. First of all, this pandemic has been a very complex situation for all of us. And to understand such a complexity, the key is to decompose and recompose all the essential elements that we need to know about. We examined with Dionysis and analyzed the situation, and we ended up in 7 main key elements that the gnoriZO concept is made of. gnoriZO is basically a content structure of 2 levels that we have developed. The first element is the SARS-CoV-2 virus. As you see in the structure has a second level of information that we need to seek for. What would we need to know? What is it? The contagiousness, what is the COVID-19 disease, and the relevant scientific research. The second element is the risk. Which are the population groups that are mostly at risk and why? The professions that are risky, the overburdened sites, and how is the risk documented? How can we protect ourselves 24/7? What do we need to do before going from home, in transportation, at work, at school, when shopping, and what do we need to do when we get back home? I was found positive. What do I do now? We need to have general instructions. What's happening when we have a family incident, at work, at school? Do we have any more information that we need, or some help desk that we can ask for help? We need to know the anti-COVID structures in each country. We need to know how many ICU are available, how many hospitals, how many doctors. We need to know what is our medical capability to deal with the situation. We need to know the shortcomings of the healthcare system. We also need to know the last trimester trend. For instance, are all ICU full, or is there space for more? We need to know if there is an improvement plan also. Vaccines. Which vaccines are available? What's the safety level of the vaccines? The benefits, the vaccination program, the upcoming treatments besides the vaccines. And last, and probably the most powerful element due to its impact, a chapter on true stories called My Story, with real stories from the ICU staff, with stories from ICU survivors that entered an ICU and made it back, and stories of relatives of the deceased. Obviously, knowing all this information is not easy, but it could prove very useful to each and every one of us. But going beyond at a more strategic level, we needed to consider what could we achieve if we had this. We came up with 6 main strategic goals. To remove informational asymmetry. We all need to have a certain level of information and above. To marginalize fake news. We had a lot of them. to restore trust, to create anti-COVID consciousness, to mobilize citizens and help ourselves by knowing and help others as well. And we could see these goals escalating. Each goal that is fulfilled is the step to fulfill the next one. We also considered that this is not an easy thing to bring to life. And we thought that it would be incomplete without a high-level realization plan with concrete steps. So we moved to that. So we created an 8-week plan. We estimated that if everything is as it's supposed to be, we will see the assumptions on how to do this right after. We would need approximately 8 weeks to do it. The project is consisted of 6 main deliverables. The first is the content development. It is fundamental to create the structure of the key of gnoriZO that we just saw, the concept. That could be done in each country. This is the example of United States, in collaboration with the National Institute of Allergies and Infectious Diseases, or their counterparts in other countries, because that is the scientific institute that can validate such information, because this is very sensitive information. The second deliverable is to create a digital booklet that would encapsulate all the content development of deliverable 1. And of course, it will be approved also by the NIAID. The third element is to create a website that would reflect the same content structure and will include the same content structure. It will allow the downloading of the booklet, so everybody has all the information, full scale, at full scale. It will have additional communication data and links for people that would want to address to some service or require more information. And also a blog that would provide news on the COVID situation. Fourth deliverable is presenting the initiative to mass media. This is not just a presentation like the one that we do on PowerPoint or any other program, but this is a product. The presentation should encapsulate and provide to journalists a product that they will use and reuse to inform people. It will also provide at least 5 ad effects, like a GIF, videos, sound clips that would be informing and providing, how can I say, information on gnoriZO. And finally, it would require to prepare an event of the official launch of the gnoriZO campaign. The fifth deliverable is the local kiosks, which would be realized by the local or other authorities in central spots in each city, train, bus stations, airports, with common requirements, providing the booklet printed, of course, and optionally, having a space for COVID-19 testing, of course, with synergy with NIAID, for people that could do it on the road. And last deliverable, a volunteering pillar that would include guidelines to people, to volunteers, on how to safely support the weak. The development of a volunteering model, which will be enabled in the social media. A registration mechanism for volunteers and beneficiaries in each group. A single, simple process to ask for and receive help. An online form for each volunteer group that would be local to register, of course, in our website. And the target groups of this would be the weak and the COVID positive at home, the people which are mostly affected in these times. Just to mention and provide an example, each of these deliverables is further decomposed, and we also provide an indicative execution process for each and every one of them. Like the one you see, we will not go through that because all this information is uploaded in the website of gnoriZO, which is hosted in the Citizen Tales. One more thing to clarify, the cost. This cost is a rough cost estimate. It is the baseline under 4 main assumptions. The NIAID to document and approve both the structure and the content of gnoriZO at no cost. The cost that we have at deliverable 1, content development, is referred only to the support of the whole process by externals, if necessary. The kiosks cost is not included. If you see the deliverable 5, it refers to the cost of setting each kiosk for the municipalities interested, and the cost will be and the kiosk will be realized by the municipalities. And last, if all activities are assumed by volunteers, the project cost can drop down to 0. Now, we understand that this is a very, very difficult project due to its sensitive nature, mostly. So we need to also provide the assumptions under which this project could be realized. The first and most important is the welcoming of the project, gnoriZO, by the NIAID, the National Institute of Allergy and Infectious Diseases of the National Institutes of Health in the United States. That is, if it was to be realized in the United States. The same stands in every other country. Second, a core team of at least 5 to 8 people to manage the project. 1 or 2 graphic web designers to develop the digital content and means. 1 or 2 social media experts to develop the volunteering model. 1 or several sponsors to boost the effort at the initial phase. Several ambassadors to carry the message gnoriZO in the scientific community. Local authorities to engage actively at their area. The timeline, though ambitious, it indicates the ideal duration, given all the above assumptions. And final, the cost depends on the execution scenarios and the engagement level of key players. The cost could be easily 10 times more. Now, all this information and more has been uploaded at the page of Citizen Tales as gnoriZO initiative. And I am glad to pass the floor my dear friend Dionysis to show to all of you the site and what you can do with it. Thank you very much.
Thank you.
So from the website where Antonis left, if we go to the website, we get on the front page of gnoriZO, there is a downloadable document including all the information. At any point on the screen, it brings you to what Antonis showed you now. And there are hot links that each of them has the enlargement or the information that you have already seen. So all the presentation that you saw, it's actually online. And the same thing for the content. At the lowest part of the page, there is this downloadable version of the gnoriZO, where again, it's the same information. It's clear that this material is open and anyone can do whatever they want with it. It is with public domain license, which means that we need no attribution or anything. Anyone can take any part or the whole or anything they want. Of course, we think that if they do it all together, there will be added value of the components adding to each other. But all the information is here. So it's, we had the feeling that whatever everyone can contribute, it's a positive contribution to the common goal. So that was the end of the presentation. I hope we didn't take much time, and we hope to have also the valuable input, because I see in the audience also many doctors and many people that have much more knowledge than we have on the area. Thank you all very much.
Thank you very much.
Thank you, Adoni. Thank you, Dionysi. Now the floor is to our audience. I'm sure they have questions for you. And also, we welcome any feedback. How can we take this further for the common good? And so maybe we could start by asking you, Adoni and Dionysis, what was the missing link that made you think of this amazing concept?
Dionysi?
Antonis thought first, so.
Thank you. All this period, since in Greece it was since March that we had the first incidents of COVID. We had defragmented information, and many times conflictual. We heard one thing, then we heard something else. Of course, things are evolving, but in many occasions, we were seeking to find the truth in many stuff, but we couldn't. We weren't sure. We needed something that is complete, documented, and scientific, responsible. I have to tell you that I started to gather information in a scattered way, because we heard something or we saw some research on the internet or in the media, and we started to look for links, but it was not working. It wasn't enough. We heard a lot of news that were, let's say, fully guided. It's not about guiding someone here. It's about documenting scientifically what is the situation. That was the incentive for us. We needed, as we started, we needed to decompose this thing and recompose it. And the recomposition is what you saw in the project. We need to know this, 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 and this. And we need to know it documented by people that are scientists, and they will, I will not say risk, they will put their name below. And their scientific, how can I say, personality inside, and their soul, I would say, even more. So that was an incentive.
Thank you. Dionysis, do you have to add something on that?
I think Dennis covered it very well.
Mm-hmm. So what are the challenges now for you? I have another.
Dionysus, do you wish to? Or should
I think now it's traveling. It's like a bottle that you drop with a message in the ocean, and then it takes its way. We hope that the new technology offers enough means to make it propagate much more than a single bottle would do in the past. And that's why we also believe that technology is a game changer, and that everybody can get involved. I think that if everyone starts thinking what would be the positive impact rather than trying to impede or obstruct someone else do what they want to do, the total outcome would be much better at the end. So that's a contribution in that step. It has been obviously influenced by the open software where everyone contributes whatever they can, and by all these collaborative efforts that we have seen that have evolved much better than governance has evolved in our countries.
Mm-hmm. Yeah. I don't know if there's anyone from our audience who wants to jump in. Feel free to do so. Yes. What about the personal story? I think this is a very powerful component of your initiative. Would you like to elaborate on that, Adoni?
We should maybe open again the screen and go back. Yes, a second. Just to have the screen and be able to navigate, or should we do it via the web page? Just a second. Just to provide some details, when we thought of My Story chapter, we thought that we saw many stories in the television or the internet that showed, I remember a woman 39 years old from England. That was my the first one I saw. She was only 39. She was fully healthy before, and she was in ICU, not in ICU. She was a step before the ICU. She was on the on a breathing machine before she was conscious. How can I say? And she could not breathe, and she was making video of herself with her smartphone, and she uploaded it, and it was how shocking that and how powerful was the image and the effort of the person that did it. I was shocked, and I still remember her face like yesterday. So this the My Story chapter can be so powerful. It can be, how can I say, it can move people to really try to do something about it, not to be passive. Yes.
Mm. Yeah. And
along the lines of Citizen Tales, because it's this storytelling component that is sometimes much more powerful than the scientific knowledge, that it's not accessible to everyone, but the personal stories are accessible to everyone. And you see all the sides. You see from the sides of the medical personnel, you see it from the side of the patients, you see it from the side of the people that remained when the others died. So I think it's a very powerful component.
Mm-hmm. Yes, indeed. Storytellers is one of our branches in the teams: translators, artists, ludics, learners, explorers, storytellers. And I really like the key here. Would you like to say more about the concept of the key?
The key came as an idea when we try to find a solution. Usually with keys, you open doors. So we thought of it as a key that will open the door of information. Many people try to exploit this situation to gain benefits. And that refers to from businesses and businessmen to governments and politicians. And that happened to all countries, not to refer the states, to all countries. So the key was, we think it was a good choice just to bond with all the information that we needed to think. If we had this, probably we would have less people affected by COVID, infected by COVID, because people would have the incentive and the motive to protect themselves, because they will not hear to fake news. They would reach to some information that is documented, because everybody can make something that is fake. But if you have something that is really documented, fake news go.
Mhm.
Everybody would believe people that would come on their own, that will expose themselves to public and tell their story, not an unknown person. I remember at one point Sharon Stone that spoke about one of her relatives that had COVID, for instance. That was also, how can I say, something that is making you understand that this is real. I think that if we had the level of information that we describe here, it would be like, or having the volunteers. If you have the volunteers and the COVID positive are not going out and they get help, they will need to shop. They will need some medicine. If you have the volunteers doing that for them, you will have less dispersion. Or if you have for the weak are, or the older people are very sensitive to this. We would have less. If we have the volunteers, it's like each volunteer is like having one more nurse or one more other personnel in the hospital, but we will not have sick people, less, because they will take care outside the people. So this is a multi-level effort that we would, if we would see it, realize it, we would be really, really pleased. That's why we made it totally open to anybody that can take something, take it, please. Take it all.
And the volunteering effort is very, very important, because when people are trying for something, then they become part of the effort. Now, what has happened is that usually it's the governments that are trying to impose things, and the people that react to someone trying to impose something to them. And because there is this lack of trust, we have all these stories that are happening. This is the volunteering part is like a Boy Scout or a Scout in general initiative, I would say. And you start thinking, what can I do to make things better? And then you realize that the other people are trying also. And maybe there are some mistakes, but you can understand the reasoning behind the mistakes. Whereas now you are just, doing nothing, and people criticize mostly and try to prove why the others are wrong. I think it's the exact wrong attitude. They should be trying to see how they could correct things. Mm-hmm. And it's also one thing that I have seen sometimes in the media, that and not only in the media, sometimes it's a more philosophical issue, that they emphasize egoism, like this Delphic maxim, for example, which is known to the Greek audience, "Osozon eαυτόν σωθήτω," who saves himself will be saved. And they usually translate that as every man for himself, which of course could be, but the maxims had always two meanings. And I think that the true meaning of these wise priests was that unless you want to save yourself, and unless you do something to contribute to your saving, then you won't be saved. So it's very important that we are part of this effort. Now we are waiting like toddlers and saying, oh, this politician didn't do what we expect him to do. And then we start crying and going to the opposition. And the opposition, of course, is promising because it's at no cost for them. And when they come in power, they do nothing again. So this is something that should be changed. It can be changed only by the people, because the people don't really have an interest to go against the government. The interest of the government and the people are together. And the same thing is here, which is a universal effort, which is even more important because all countries come together.
And Dionysis, it is here exactly in the component of volunteering that we have a very interesting question by one of our members of the audience, Avgi Atmatzidou, who's asking, how can I participate in the project? How would you guide her to participate as a volunteer to this project? Are there steps that are needed to be, like, to identify the expertise of the person and then the time, or how would you advise these people who want to become members of that initiative against COVID-19?
Vassiliki, may I?
Yes, of course.
Thank you. We would start from the assumptions.
Mm-hmm.
It's very, very simple. We are at, for this, not project, initiative, I would say. The project is what we don't have. We have the initiative. This is the initiative. We have the high level description of the initiative, which is relatively complete in what needs to be done and how could it be done. We don't have a project right now. We have a proposal to anybody. It's an open call to anybody. So if someone wants to realize this, should pursue the assumptions. The first, I would say here, the first is the NIAID to welcome the project because of the sensitivity of the content. Probably we won't start from that. This is the most important. That's why it is first in this list. We'll start from formulating a core team of 5 to 8 people that would be ready to prepare and move on beyond this. We have this, and we will disseminate. It's already disseminating. This is traveling already because we will have the video on the YouTube. The site is, the initiative is uploaded. It's open, so it's already traveling. This is a small village in the internet, this world. So it's traveling. And I would say that to all participants, if you are interested, first read it thoroughly, once, twice, because it takes some time to chew. Because ourselves, when we did it with Dionysis, we had to chew some stuff. If they are, how can I say, feasible. And we try to create something that creates the baseline that we can go up. So the first thing that one can do is not thinking about how to participate in this team. Probably this team would require some people that have already managed some projects or are close to that area. But the first thing that one can do is take this and disseminate to friends, to, let's say, influential people, or to whomever else he think that can help. If anybody thinks that can do anything more, he is welcome. He, she is welcome to do so. This is an initiative, and probably it will require further initiatives if to be realized.
Adoni, if someone identifies something else that can be added to this initiative, how open would you be to redo or to enhance this initiative?
First of all, we are open to any, how can I say, any further initiative that would improve this structure, because this is not just a start, it is the concept which has the information structure, which can be discussed, of course. The project, which is more, let's say, it's more hard material, because it has to do with creating a work breakdown structure with works that need to be realized. Of course, it is a matter of decomposition. If we had to go more, it's not about what else can we put. It's if we are taking further steps to create a full-scale project. that requires planning, thorough planning. But that would require also some sponsor to help, not for profit, but when you are at the start is the half of everything, we say. So we are now at the start. If someone can give it a push, then this will, how can I say, this will take off. And I think a sponsor would be critical at this point, but also the state, the scientific part, the institute, to embrace this. Because imagine to prepare the shell but not have the content.
Mm-hmm. So there is also another member who raises a very important issue. She says there is no trust. That's the problem, especially in Greece. There is no trust. I would love to hear more about from whom towards whom. And you touched upon this, the fake news. So that's a complicated matter. Would you like to respond to that?
Yes, of course. Trust in this, if we saw it at a strategic level, like the COVID situation, has to do with trust in, not in governments, in governance. How governments dealt with this issue so far. If we see and examine different examples from different countries, we will see that it had to do with leaders, because we heard leaders that said that this is just a flu, publicly. Not names, names are not necessary now, but we are trying to say that trust is something very difficult. You can lose easily, and you create by hard work. So, to me, I would go again in the assumptions that we are now. If the scientific but public scientific institute responsible for infectious diseases, like we have our own in my country, like the NIAID in the States and others, would embrace this. This is the first indication of promoting a policy that wants to achieve a different level, a higher level of trust, because they would provide more information. I'm not satisfied by the information I am given. I've heard here in this country, which is reasonable because it was the start of the crisis and the knowledge on the virus and the pandemic was not at a very high level. Now it's much, much higher. So we heard no masks. Now I'm not allowed to go without a mask, which is, I consent to that. I find it normal because it is a fine of 300 euro, just to tell you an example. So that in 6 months or 8 months changed completely because the pandemic is evolving. If we had this structure, but at full scale, and updating it, I think it would be a very important element of governance that wants to create more trust to citizens. So that is one way to do it, to embrace it, the government to embrace it, but not at the political level, at the, let's say, at a more technocratic level, scientific. And each country has its own institution that is doing this business. It's not a business, this competence. They're exercising, they're responsible for this policy.
And she adds, Maria Toloudi says, usually I listen to 2 opposite radio stations to have a full view of the problem. I mean, of the news. Second, the personal responsibility. And I think this touches upon the idea of governance rather than government that you mentioned, Adoni.
of course, government is, how can I say, it's more institutional. The governance has to do with processes and people and choices. So we do not expect the choice to be still while the world is moving, but we expect to have more complete information. We expect to have an honest approach to people. We also understood that the leadership, political leadership, not only was afraid of the situation, whatever they say, however powerful they might look, they are also people, and they have things to afraid. But still, we don't think that the governments approached this pandemic as a problem of information, as we did. So they tried to tackle this, but while they tried to do it and not understanding it also, it went over them. So we don't want to, how can I say, to just say that we do not trust the governance and the governors and the leadership. No, we just need to say that we can make a new start with this, and we could, by dispersing it, create, how can I say, the will to many people to ask more on this path or demand this, depending. Now that the internet is making this world a small village, we had seen, how can I say, funny videos going around the world in less than 24 hours. Just to say something which is like funny videos, like, how can I say, you could see them around. I could see my friends in other countries having the same video on Messenger. Mm-hmm. So I would say dispersion of this, maximum dispersion from everybody to everybody, and see what's going on.
We have another comment by, yes, go ahead.
One bitter comment to what Maria said before about the two opposite stations to find I think the truth, she said, or to have the full view of the problem. I fear that even listening to two opposite stations doesn't give us the full view of the problem. And that's why we are so much for open data. We think that our countries and the world in general is our common home, and it's our common enterprise, and it's our common duty, and we should be having things open so that we can really judge by ourselves, because unfortunately, even opposite stations are filtering with their own filters and are trying to do things at their own interest. So that's the main problem, and that's why trust has been lost, because we just play between people that are just exchanging the balls in a game over our heads. That's my feeling, at least, about it.
And it's along these lines that we have a very interesting comment by Maria Kakavas from our audience. What you stated in your 5 goals are the most important and necessary thing to have gnoriZO achieve its goals, create community spirit and human concern for one another instead of the spiritual isolation.
What would be the most important goal is, I think, the last. I think that you have, you can see the screen where there's the concept and everything. The goals have some, how can I say, they work like a step. Imagine we don't have the same information level, so we need to remove informational asymmetry. I know this, the other knows this. We need to bring the Libra close. We need to have and this is not going to be just a Libra. This will be the base where we'll need to learn more and go up. If we have that, we will marginalize the fake news, because we will have scientific and documented information. If we have that, now again, trust, then we will start to trust more what is going on. And that is also a matter of governance that my dear friend Dionysis is so interested in. which is normal. Everybody should be interested in. Because the people in governance would have less space to move because of the scientific approach of this. They cannot say anything and pass. Because it's very easy. You have this scientific research that says that we should do this and this and this. I had a scientific research the other day, 1 week ago, that was talking about masks. I will finish with the goals, and I will, if you're interested, I want to give you some of that thing. The next would be anti-COVID consciousness. To have the consciousness takes time. If you have trust, you will gradually realize that we all need to move against it, and we need to be more responsible, and we need to be more active. If we are more active, we will start to mobilize. The next goal, mobilization. We will start to mobilize, and we will start to have confidence. And if we have confidence, we will be able to help ourselves and our neighbors and our friends, because we will know what to do in an emergency, because we will know how to protect ourselves, because we will know what to avoid, why to avoid it, if it is contagious, why is it contagious, and how much. And now we'll bring you what it came up to me. I saw one research that was made on masks, and not only they were how can I say, providing data, processed data from the research about the level of protection. The level of protection is not the same per mask. You have masks that give you 100% in the movement of the virus, but you need to have to wear it on the right way. And both people, if you are or more, need to wear the mask. No, if they are cotton, they are less. So they gave, because they made the research, very detailed data, the kind of data that we would put in here for people to realize what can they use to protect themselves and why exactly. That kind of data is the data that we need. So the goal that I believe is the highest, at the highest level, is to be able to empower ourselves to help ourselves and help others. This is the highest goal. If we do that, it will be the highest level of doing something, because we will be motivated to do anything.
Which is also the core mission of Citizen Tales Commons, creating structures of empowerment for both members and the people who are in contact with them. I would like to encourage everyone to speak instead of writing their comments or questions, so we have a much more participatory
May I say something?
Yes, absolutely.
First of all, thank you for this presentation and for this initiative. Excuse me, I couldn't participate in the first 10 minutes, but then I listened and understand. I would like to share a few of my experience during COVID about fake news, or how can I empower myself, my colleagues, and in architecture, and my friends, my relatives, and so on. First of all, science is the first and essential point for me. And yes, during COVID, I have been reading lots of news, but as a scholar, first of all, for instance, CDC, Center for Disease and Prevention Center. This is one of the scientific knowledge resources for me about COVID. As an architect, for instance, American Institute of Architects have been publishing and sharing lots of guiding documents with some experts in architecture. I'm originally from Istanbul, Turkey. This is the part of the United States, but in Turkey, the situation is much more complicated. There are lots of fake news, and architecture community cannot find the scientific direction very well and so on. But as Vassiliki knows me, one of my mission is to operate as a citizen architect. So during COVID, for instance, I ask myself, how can I help my colleagues or my relatives or my friends in Istanbul and Turkey, for instance? Before my PhD, I was working, for instance, as an editor. And now I began to serve again as an editorial board member of a professional architecture journal in Turkey. During COVID, as much as I can do with my Turkish articles in architecture in this journal, I try to create their critical awareness of scientific view. Or secondly, I began to give my online Turkish lectures to architecture students from Boston to Istanbul and so on. So all of those things in these initiatives, as I understood from your presentation and from my own view as a citizen architect, because this is Citizen Tales lecture, science and scientists are the essential and components and essential key for all of us. So I can empower my colleagues in architecture and the people from society by explaining scientific information, knowledge resources, and scientific experts in public health issues, because we have been talking about COVID-19. But if after this lecture, I wanted to read your documents more carefully, then I would like to share with you how can I participate, how can I help better to you. That's all.
Thank you, Meral. Yeah, you it's the same thing. You endorse what Adonis said in the very beginning, that is, we start from science. We start from the documented.
In conclusion, the last sentence for me: fake news is not the essential knowledge resources for me. Science is the essential knowledge sources for, I think, all of us during COVID-19.
Yeah,
that's exactly it. There's no space for both of them. One of them needs to go out of the room. Simply.
True.
Adoni, I'm going to go back to this very, very sensitive matter, the vaccines and treatments. How would you deal with those conflicting views, interests, etc.?
When this information, let's say, scattered again, started with vaccines, we learned, because I'm not a doctor, and my medicine, I think it's at the same level as yours. So I would, low, that's what I mean. I learned that there is a new technology in vaccines that is called mRNA, and that is to be enabled. Nobody explained to me still today if that technology is safe. They say it's safe. I need more information. They all say it's safe, but we need a different level of information, more detailed, more scientific, like said before, right before. And how can I say? Responsibly documented and publicized. When I say responsible, I mean by scientists and their name below in the publication.
Yeah.
Like the research I saw the other day. Very simply. It is like that. People are making research, they need to publicize. And if it is on COVID, even more. And if we need to have a validator on that, not a validator, because research is research, but if we need someone to embrace that, maybe the authorities in each country should. And they should gather, they should have done this. And if all of this was not feasible due to concept development, okay, I can accept that. Let's drop the concept. They should gather all the scientific research and upload it on COVID. We saw scientific research in Thessaloniki on COVID, and it wasn't from medical. It was from Dionysis. It was Aristotelian University for the movement of the air. What's happening with the dispersion? And they made a study because they made that thing that they know how the air is moving, and they said how far and how dangerous is COVID-19. And it was in the summer, I think, which was wonderful. And they were not architects. I don't know if they were mechanics, for sure. But they had the sensitivity to go on COVID against and publicize. That was also one more study. And I think there are many studies around the world, many, hundreds. Right now, we are not aware of hundreds of researchers.
Mm-hmm.
I think some of the countries too. I had a friend who moved from India to China to teach. And when he first got to China, he was not just asked to isolate, it was more a mandate, and they had someone come to him every day and get a list of what he needed and go out and get it for him and bring it back. And so they knew that he was isolating. And this happened for a period of 14 days. Here in the States, there are so many people who, even knowing that they're positive, don't isolate. And that is such a big factor, I think, in all of this. And so I think sometimes we need to look at the countries that are handling things well and really pay attention to what they're doing to handle it and see if we can apply it in our own countries. It won't always be possible, for sure. But this being left up to the person themselves to do, at least here in the United States, is not working.
So this comes back to what we said earlier, that we really need to cultivate a civic awareness to our citizens, to be responsible, to care about the common good. And that's the beginning of everything. So at least we can do our best to ignite this discussion.
Mm-hmm.
And so what you said about the person who did not even tell that he or she was positive is so scary.
Mm-hmm. Yes. And she was working with an older population, like driving them from place to place and exposing them, and didn't, no matter how much I sat and explained to her what she was doing to others, it just never seemed to get through. The only thing she thought about was this was her livelihood and she had to maintain that. And so I just don't know how you get around things like that, I see some of her points. Of course, I don't agree with those. But, then how do we help her be able to afford a very minimal lifestyle while she's, being quarantined? And how do we guarantee that she will quarantine? Those are the things I think that above and beyond the science, which is very, very important. But I think that those things also have to be given maximal consideration, because people won't do something for anyone else if it harms them, you know, in their lifestyle.
Yeah. So important. So we need to also make people aware, those who make decisions, that there has to be some other structures of empowerment for help of these people who cannot do otherwise, like the person you mentioned. So yeah, we have to make that clear.
Mm-hmm. Yeah.
Can I speak?
Absolutely. Thank you.
Yes. Well, I think the difficult part for the people who are not doctors is that they have to decide for an issue which they don't know and they don't understand. So it's difficult to decide what's good and what's bad. And then you rely on which information comes stronger to you. And information to the people does not come through specialized sites. It comes through the internet and through the pages that they read, through messages, through Facebook, through all those. So I think you must not expect the people to reach you, but you must reach the people. You may have very correct advice and very sound explanations, and you can be really with good intentions, but the problem is how you will infiltrate their life. You have to give that battle, which we all hate, to get in the internet and fight misinformation and all those non-specialists. But we must do that in a very, very, in a way that they will understand. And then we cannot make everyone. We cannot persuade everyone. We want to persuade those who influence other people, and usually they understand a bit more. So I think that we should see the other way around. Is how we will infiltrate the lives of people and give them the information that we need and that they can understand. Thank you.
Thank you. Absolutely. So, and I like your point, the other way around, to reach out to people who can influence and make decisions about the lives of the people who don't have other means to cope with the reality of the pandemic or any other similar situation. But how willing are these people who are influenced and make decisions to really open and do the right thing?
What exactly is the question? How?
I mean, it's just, I'm so skeptical about the filters that these people who are making the decisions for the majority of people are open to these questions. I mean, I think they should at least read what we offer here, but how many of those who were invited from the governments, etc., thought that this would be a worthy initiative, for instance?
You should not, I don't think that we should do it from governmental institutes. We have to do it the other way around, the one that we don't like to do, the one that you have to work. And I had a small experience with a small video that I made lately. It's down now because I'm going to change it a bit. But in 4 days, it had 5,800 views. It was just explaining a few things. And it was, I understood that people needed information in a way that they could understand. It was on a blackboard with a chalk. And that's how it worked. No PowerPoint, no deep analysis, but anyway. And now I'm getting a second version now, and next week it'll be on the internet. So I never thought that this could work, but it did work. It did work, and I had very positive feedback. So I think that is the way that we can get to them. It's not it's not that we have the truth. It's not that we have good intentions. It's whether they will hear us or not. So that's the wall that you should break.
Yeah, would you like to share this video with us? I would love to see it and maybe learn from it as well.
I think Dionysis has seen it, and we spoke today about that. It was the first time that I spoke with Dionysis. Well, it's a video which explains how this mRNA works, and this mRNA vaccine works, and generally how vaccines work. I'm a doctor, by the way. And so I tried to make it as simple as possible, and that's, well, it was interesting for me also, but I didn't expect this thing to go so quickly to be. And okay, you'll see the next version, obviously.
Wonderful.
Next week, yes, yeah.
Thank you for this.
Okay, I'll send it to Dionysus and he'll forward it to you.
We appreciate it, Doctor. Yes.
Okay.
It was amazing now that it came up. I didn't know whether you wanted to say about it, but it was a 11 minutes video. And to me, it was also very important as an act of civic engagement. Because Dr. Kogevinas had not a YouTube channel. He hadn't done such a video before. And then I could see the dates. 27th of December, he said on the video that he was recording the video. 30th of December, it was the video that came up on YouTube, and he created the channel. And then it was so viral. And it's very interesting that people are so thirsty for such information. And it was an amazing, condensed academic lecture, I would say, in 11 minutes for people like me that are not in the medical profession. So I could understand how the mechanism works, and I could stop fearing the vaccine. So I think it was a very important contribution. It's very important that it just came from an individual. Actually, when I saw the video disappear, I was afraid that someone put it down or something, because we don't know how YouTube reacts to things. But fortunately, it was just his choice. So now we expect Antonis' next
yes, I took it down because there were many hospitals and doctors interested in that, and they wanted to project it, and they wanted to teach the nurses and things like that. And well, I had to add some things, so I didn't want this thing to because then it would be difficult to have a second edition get so. But anyway, it was a new experience for me, and I think it's a part of the puzzle that you are searching for. It's one small part which is maybe crucial. Okay, so thank you for letting me introduce this. But it was for me also, it was a surprise how quick this worked.
It really shows how people are in need of true information, to reliable information, so that they can make the right decision. Yeah.
It was information the old way, you know, with the teacher with the chalk and writing on the board. It was funny, but I made it for my patients and for some friends who asked and said, "Oh, well, I'll make a small video for you," and then it went like that. Okay, so.
Wait to see it.
Sorry?
I just said I can't wait to see it. It sounds very interesting. I have a background in medical technology, so.
Well, yeah. Well, we'll see the next edition. So thank you. Okay, so let's get back to your project. Let's finish with the video. Yeah.
Thank you so much. So we have 15 minutes left. So this discussion is getting so interesting. So feel free to jump in and bring more points and maybe more suggestions how we can take this initiative to a step further for the common good.
Well, just sharing it to people that we know, I think would be one start. And I was just on a Zoom call the other day with people that I used to go to school with. There were 17 of us, and we hadn't spoken, some of us, for 34 years. And I think almost all of them would be interested. So if you don't mind, I'll pass that information to them.
Absolutely. Same with our collective. It's open. Anyone is welcome to join us, and they come with their own projects, and we support these projects, and we really collaborate. We have done several collective presentations, conferences, etc. So, and with the Zoom technology now and other similar platforms, we can do so much more. As you said, we reconnect, but also we rethink things again.
Yeah.
Just one comment.
Yes.
Please do. It's very simple. And them also to disseminate more, because that's what is necessary where we stand now. Because maybe one person can have more means to move things forward.
Yes.
So it will be, you never know. So the message is, take it, use it at will.
Mm-hmm. It's like the Wikipedia projects, right? It's a common effort. And it's common knowledge. We offer it and we improve it based on the feedback that we receive from everybody who also cares about what we care. And we care about the benefit of the people. We care about the health of people, a healthy society. So it's crucial that we learn from you. We know what, and then we leave, as you said, going back to the meaning of this initiative that Dionysis and Adonis have created.
Now that you brought up the Wikipedia, it's very important to have the localization of knowledge. It's what we are trying to do also here, because there are very dispersed efforts and they go to waste. And we can see that in all domains. We can see what is written on the internet in articles, and sometimes the comments of the people are more important than the article itself. Yet, because there is this time that goes on, all these disappear because they are not somewhere put together. So this immense contribution Wikipedia has done to put them in articles, a similar thing could happen also in other domains, and localize the knowledge and also bring together the people that have the common interests. And then their effort wouldn't go to waste. We have a project with Adonis on that, but that will be the subject of another probably meeting.
Much bigger, actually, but it's the long-term one.
Yes, and actually we are going to touch upon this in our next Citizen Tales lecture with Professor Catherine D'Ignacio from MIT, who is going to present her book, her newest book on data feminism, and is going to show to us how many missing data exist when it comes to feminism. But it's really important. So we would welcome you to our next talk as well. It's going to be next Wednesday. If you are interested in joining our emailing list, we will add you, and that way you will be informed about our next events. But also feel free to visit our website to see more information, to see who is part of us and what our specific interests are and how we collaborate. And it's open. Feel free to share it with anyone who you think might be interested in joining us, not only for this gnoriZO initiative, but also for the Citizen Tales initiative. We have many publications coming soon with collaborative efforts, one of which is the Journal of Civic Media, in which many of our members have contributed, and look out for our Civic Imagination journal issue that is coming in about 2 weeks from now. So you're going to be informed about that as well. How basically we can imagine a better, equitable, diverse, inclusive future. So I think we are almost done with the time that we had in our disposal. We still have 10 minutes if you want to jump in. But I want to thank you from my heart for joining us. And thank you also, a big shout to Adonis and Dionysis. Thank you so much.
Thank you.
And we are really happy to have you as members in Citizen Tales Commons. And we're looking forward to seeing this initiative's next steps. Again, many thanks.
Thank you very much.
Bye.
Thank you all.
Thank you.